This is Andy Schumann from Ed Gizmos with another interview. Today I have the pleasure of talking with Wendy Stevens, who is the Director of Business Development for VitalFlo. She is a BSRN, and thank you, Wendy, for joining us. Can you tell me a little bit about VitalFlo? When did it start? What's its purpose? And then we'll have you demo the product for us.
Yeah, so VitalFlo started about 5 years ago out of NC State and working with UNC and Duke to design a solution that can monitor lung function in the home with a very simple spirometer and get live data to the physician so they can start see trending on the patient's lung function if things are starting to go south, to be able to intervene before having that patient end up in the ER. And so also we give feedback to the patient so they can see how they're doing in terms of their performance. And we've had really great success on the provider side, as well as working with the CDC, NIH, and various grant studies with UNC and Duke.
Okay, so it started as a academic project or a project internal to those universities?
Correct.
Okay, and when did it become a commercial venture?
About 3 years ago.
Okay, and so right now, is it something that is available to the general public, to physicians for use?
Yes, it is.
It
So
is, okay.
we actually are working with various providers across the country.
Okay. And did you need to seek FDA approval?
We do the actual spirometer is already FDA approved, but then you also have to get FDA approval for the software. And so
Okay.
we have that. So we have a clearance by the FDA.
Okay, and when did you get the FDA clearance? Was it also about 3 years ago?
That was just recent.
Recent, okay.
Yes.
So, with it recently being granted to you, it's only been on the market, I would think, a short time. Is that correct?
Right. So I would say in terms of the provider market, it's been probably, the last 6 months.
Okay,
Yeah.
very good. So, so tell me what Vital Flow is and how you combine a spirometer with software to enable pediatricians and other providers to better take care of patients with respiratory problems.
Yeah. So there are a couple pieces to using the device. There's an actual spirometer, which is very easy to use. It's portable. You can wash it. Very inexpensive. The patient takes us home. And then there's actually an app on the phone that they download. Hello, this is Wendy Stevens at VitalFlo, and I'm going to show you as a patient being in my home environment how to use the VitalFlo app and the spirometer. So this is the spirometer. Each patient gets their own. It can be washed very nicely and put back in. So what you need to do after you get the spirometer is you're going to get an email from your physician telling you to download the app. So you download the app, and I'm going to click on that. There's two pieces here. One is the survey. So I'm going to take the survey, and it's going to ask me a couple of questions. This could be for asthma or for COPD. How would you rate your asthma right now? I'm okay. Next question. Has asthma affected you at work or at school? Yes. Next question. How many times do you use your respiratory inhaler or albuterol since we last spoke? Twice. Did you have any symptoms that affecting you from sleeping last night? Shortness of breath and wheezing. Next question. Do you have any symptoms during the daytime since we last spoke? Shortness of breath and wheezing. So I have completed the survey. So now I'm going to go to spirometry. So there's a little tutorial. It's really good to see this spirometry tutorial the first time. So I'm going to let you see it before we start doing spirometry in your house.
Joshua is going to show us how to do a proper blast exhale. He's going to start by sitting up straight with good posture. He's going to hold his spirometer straight out, and he's going to hold it in front of his mouth. He will then take a deep breath in, as deep as he can, then form a seal around the mouthpiece with his mouth, making sure to place his teeth on the mouthpiece. Then he will immediately exhale his breath hard for as long as possible. Okay, let's do a test. Take a deep breath in, place the spirometer in your mouth, and now exhale hard. Go, go, keep going, keep going, keep going. Good.
Example of how to do your spirometry. So now I'm going to launch the test on the phone, connect to the device. So as long as the device is near your phone, it's going to connect. It disconnects once you're not using the app and you're farther away from the phone. So next we're going to start the test. You'll see here there's a little spirometer, and we're going to start the test. Waiting for results. So it says I've got a good blow. Now, if I do an inappropriate blow, the software is very sensitive to picking that up. So I'm going to give you a bad blow to show that it is very sensitive to doing inappropriate blows. So I'm going to start the test. So it says I did an abrupt end, so I'm going to try again. So you'll see here that you can have successful attempts. I want to have 3 successful attempts out of a total of 8, so we can get good data. So I'm going to start again. So I got a good blow. And last and not least, one more time. So waiting for my results. So it says I did 3 attempts. So I'm now done and the test is complete. The data is now immediately going to go to your physician so they can review the data. Thank you and have a great day. So we're going to log in. Dashboard, you can add patients very easily here. As you saw on the screen, once you set up the patient, they'll get a little ping with the invite. The main things that we really need from the patient that affect the results are your height, weight, and age and ethnicity. That really makes kind of a difference because we go off of the standard NIH guidelines. And so those are very important points that it can affect kind of the data that we see. So this is the patient portal. And you can see there's various colors here. There's symptoms, and then there's lung function, and then the patient's name. Also when they did their last reading. And so if we go into Sarah, you can see what her lung function looks like. Again, once the patient does the blow, the data automatically pops up here. And so there's different ways of looking at the blows. We can do a total of 8 blows, but we really need are 3 good blows to get some predictive data here. So it can be the GLI standard or the NHANES standard, depending on what the physician wants to look at. And then you can see in the green, this is like they're in the good zone. And then in the FE F ratio here, this is a little low. This is about patient versus low level of normal.
Mhm,
So a nice visual here is this is kind of where the patient stands on these 3 different blows.
mhm.
And then you can see the actual graphing here of all the blows. You can eliminate blows if you want and pick the best blow. And this is kind of the predicted PEFR that we would be looking for that patient's age and ethnicity and height and weight.
Right. Okay.
Yes,
Very
and
good.
then
So this is nice. It's very appealing. Can you scroll up to the top again?
mhm,
So it's evident your device is more than peak flow because you're doing full spirometry at
correct.
home, which is something a pediatric pulmonologist does virtually with every visit. So this is very nice.
The other thing that is really important is kind of the adherence. So we also track with a calendar how many times a patient has used it within a 30-day period,
Yeah.
because that can affect the billing process. So we like to get 16 blows within a 30-day period. One, it gives a nice blend of data of what's going on with the patient, as well as it helps with the billing. So you'll see here an adherence widget, and then also some colors like how you did in the survey, and then in the spirometer reading.
Mhm.
Also, there is a glossary. Again, not everybody's a pulmonologist, so
Right.
for the ability to kind of know what they're looking at. Here's the survey for that particular patient in that day of doing the blow, and then there's notes.
Right. So this is very interesting. So you're saying that if I have a bunch of patients I follow for asthma, or I follow with asthma with varying degrees of severity, I could perhaps physically see them, right, every few months, but I would monitor them using your system, and I'd be able to bill on a monthly basis for monitoring them.
Correct.
Okay. And I would be able to tell when they're having an exacerbation, and I could possibly combine this with a telehealth visit, and I wouldn't necessarily be able to auscultate, obviously, although there are, stethoscopes capable of recording, auscultation and transmitting it to me. But I think just having the data that you present would help me make some clinical decisions.
Yes, and that's what we found with providers is, let's say the patient did a survey and they kind of said, "Oh, I'm feeling okay." But when we actually look at the data, the patient is starting to trend in the wrong direction.
Right.
So they've called the patient up and they've made medication changes, and the patient actually started to improve, and the data scores started to go up.
Right. Oh, that's great. Okay. So again, just to kind of ask the question again to make sure I understand it, there could be a one-time purchase uh, on the part of the physician who is allowed to sell it to the patient for $150 or not.
You can do that. Again, it's the insurance is a little harder for coverage in terms of a medical device. So yeah, they could sell it directly to the patient, which I think kind of gives them a little skin in the game. Or the physician can absorb the cost, through the monthly subscription and not bill the patient for the medical device.
So the device, can the patient purchase it directly from you? So I don't have to be a seller of a medical device.
Correct. And yes, they can.
Okay, so, all right, so that's good. And the price would be the same?
Yes.
Okay, what determines whether it's 125 or 150? Is there like a carrying case or some accessory?
Yeah, no, there's actually oximetry is going to be coming out on the spirometer. So that is going to, depending on what they pick, the cost could become a little higher.
Okay, so in that range. And when will that be available, do you think?
The oximetry, the pulse ox is probably going to be in the late fall.
So this year, okay. And you said the subscription is a subscription to the provider per patient or per month for
Yes.
unlimited? Per
It's
patient.
per patient per month. Yes. So it's a 30-day subscription for each patient.
Okay, and you said originally it could be 15 to 25. What
Mhm.
distinguishes whether it's 15 or 25?
Yeah, so depending on the number of patients, how many they have to make it scalable, then the price can
Go
come down.
down. Okay, so a provider might want to trial this and will initially pay 25, may trial 10 patients, may
Mhm.
like it, and then scale up to 100 or more. But that's a pretty good price tag. If someone had 100 patients on that's a good bill per month. And one has to be cautious about getting payment from insurance companies. And in this age of deductibles and so forth, have you marketed this to insurance companies directly?
That's something we're going to start looking at doing because it really could help the insurance companies kind of lower their costs to keeping patients out of the ER in
Yeah,
the hospital.
because there has always been a focus on the part of providers as well as on insurance companies on keeping patients well. And patients tend to be non-compliant. When they're well, they tend not to take their controller meds and things like that. And I remember several efforts on the part of New Hampshire insurance companies to have educational programs for providers and patients. And for whatever reason, it didn't persist. It didn't reach fruition. So, but you're now in dialogues or will eventually be in dialogues with insurance companies.
Yes, yes.
Okay.
So, yes, I am talking to some of the Blue Cross companies in early discussions.
Okay.
So, yeah, I definitely think that there's a value here for the
Okay.
insurance companies.
And as far as you know, do you have any competition?
There is a couple companies that are out there that do something similar. I think we're really kind of on the stronghold of being in the complete medical provider space and very heavily on the research side. So we work with, Duke, UNC on a lot of research grants, CDC, NIH.
Okay. And you can provide me with some references where you use this device and publish studies regarding its efficacy?
Yes.
Okay. That sounds great. And are you looking at integrating, you said a pulse oximeter, how about auscultation?
I think that's something that could come later. We kind of are at the mercy of the spirometry company and what they decide, they can add to that medical device.
Right, okay. Is there a patient-based service? So while we're talking about a physician service, can someone with asthma, monitor their own progress independent of a physician? Does your platform support that or not?
Yeah, not at this point. I think it's something that we are looking at in the future, kind of like a Fitbit
Yeah,
kind of
yeah.
environment. Yeah. So I think that is something that is on our roadmap to kind of give that patient that self feedback. I mean, our device will be giving feedback to the patient in real time, but in terms of it, being completely disconnected from a physician, that's probably something we'll be looking at maybe later on.
Okay, sounds good. So Wendy, don't go because I want to talk to you after I stop recording, but I want to thank you for this excellent presentation. I like the concept of using a connected technology in a way that can facilitate better care for patients. I like the idea that it will complement telehealth and enable us to make changes to management without needing necessarily to auscultate the patient or bring the patient into the office. So I think it's a great new method of providing better patient care. So thank you, Wendy.
Yes, thank you very much.